Hi, my name is Jolene Philo, and on behalf of the Wonderfully Made Family Camp Planning Committee, I would like to thank you for volunteering. We are so appreciative of you spending the time with us that weekend and now to do this training. There just isn't time on the Thursday night that camp begins to train you adequately, and so our solution is to have these video trainings so that you can get some of the information ahead of time. If you are a new volunteer, you will also be meeting with us on Thursday evening, that's May 31st, before camp starts. When you get to camp on Thursday, you will go to the Dave Martin Chapel and you'll register there, get your room assignment, and go get unpacked. Then you'll come back to the chapel between 6 and 7, and we'll have a meal for you. After that, we're going to do some training from 7 until 9. For new volunteers only. From 9 to 10, we'll have all the veteran volunteers join us and go over some housekeeping matters about camp. But before we do any of that, I want to take a minute to have you watch a little video clip that gives you an idea of why we are doing our camp this summer.
Chris is in 11th grade and pretty much on his own in high school. He has a mentor that helps him. No biting, Chris. All right, Chrissy, go to mom. Let him walk off if you don't mind. Yeah. Go to mom and I'll be off in a minute. Go to mom. Chris probably had one of the worst diagnoses ever. Self-injurious, swollen intestines, poisons in his systems, neurological damage, mental retardation, severe autism, almost the Crohn's disease. Chris did not communicate, he didn't sit down, he didn't put on clothes, he wouldn't go outside. He ate the walls, he ate the table, he ate the rug. We couldn't eat in the home, we couldn't have lights on, we couldn't have the TV on. If I coughed, he would run downstairs and punch me. It was a 24-hour day job. Chris never slept, he never ate, he wore diapers, never spoke. And I was pretty much told to put him in an institution. It was obviously depressing, but so we went on this battle, you know, to educate and to provide therapies. His mom went and studied everything she could get her hands on. She visited hospitals and schools and Johns Hopkins and Kennedy Krieger and Rutgers. And she set up a school in our home. Our home became a school. It was one of the first centers of ABA, which is Applied Behavioral Analysis. We set up intern programs with kids from Penn State and Franklin and Marshall. And we began teaching Chris. I thought to myself, if he's happy, if he stops hurting himself, you know, if I could hug him, that would be the greatest gift in life. And we continued against all odds, and he got better. I was telling him that you go to Elizabethtown. Where do you go? Elizabethtown? You tell.
Elizabethtown High School.
Elizabethtown High School. And we're very proud of that, right? And we collect a lot of movies. We buy movies. Yeah, so I'm going to just talk about you a little bit because I love you. Have a kiss. The thing I've learned most over the years is to be a parent first. It changed my life completely, put me in another direction. I was able to love unconditionally. And I never thought of him as this poor, broken human being that we need to cure. You know, he's not sick. You're trying to get me to go?
What you saw there in that video was the intensity of this father's love for his son who lives with special needs, and the amount of time and energy this dad and his wife have put in to their son's life and giving him the best life he can possibly have. Our purpose for this weekend is to give kids like that son an opportunity to do things that all kids enjoy doing, and an opportunity for the parents, his primary caregivers, to relax, network with other parents like them, have a chance to get out in nature and just enjoy themselves. And by volunteering and being one-on-one buddies or serving in other capacities, you're giving parents that chance for a break, and you're giving kids an opportunity to do things they may not get to do very often. This camp is a way to support the whole family. from 9 to 10 on Thursday night. We're going to be having an all-volunteer meeting, so you will have a chance to ask questions about the handbook, questions about this training, Kim's training, anything else that comes up. So you might want to have a pad of paper handy. You may want to pause the video so you can get that, and a pencil. And you might also want to go to the document files section on this page up under the main profile picture. You'll find some documents, and there is a document that has a handout with the information we're going to be going through now. So if you need to pause, go ahead and do that and come back and join us when you're ready. There are two basic guidelines that are important for every volunteer to remember, whether you're a one-on-one buddy, whether you're helping in the horse barn, whether you're helping with crafts, whatever you're doing. Remember that confidentiality is paramount. Keep what you learn about your buddy or any child or any family who is here at the camp to yourself. We want to preserve their privacy as much as possible. Kind of think of it as, you know how if you go to the doctor's office or a hospital, you get the HIPAA guidelines about everything, how they're going to keep everything private, not tell anything about your condition. That's the level of professionalism and confidentiality we want to maintain here at camp. So just whatever you learn about the buddy that you're going to be working with or the family, that is private information not to be shared with others. The second thing that I think is really important for you to remember as you're interacting with people this weekend, especially the children we're serving at the camp, is to think of the chronological age of the person you're working with and act accordingly. We will have kids here who are 10 and have a developmental age of 10. We'll have kids here who are 18 and maybe have a developmental age of 5. But when you're interacting with whoever you are working with, you need to remember their chronological age and treat them accordingly. Even if a 17 or 18-year-old has the ability and the developmental age of a 5-year-old, that person is nearly an adult, and we can serve them best by treating them as an adult. Now, if the topics of conversation are more at the level of what you would talk to a 5-year-old about, that's just fine. You want to engage that person at their interest level, but always remember the age and treat that person with the dignity and respect they're due. Another thing to remember is to avoid some terms. There are some really loaded terms when you're working with people with disabilities and people with special needs, and some of the words that have gained a negative connotation include words like handicapped, retarded, crippled, deaf and dumb, emotionally disturbed, slow, infirmed. Also, we don't want to call our buddies a case, a client, or a patient. They're just our friends. They're our buddies or campers. That's what we will refer to them as. Other words to avoid or phrases to avoid are mentally different, unfortunate, autistic, epileptic, diseased. What you're doing when you're calling someone autistic is you're defining them by their condition instead of as a human being. So we want to avoid those terms. Other words to avoid are suffers from, victim of, because we're automatically telling that child or their family that they're living with something awful and their life really isn't as uplifting or normal or typical as anyone else's. They have big problems and we're here to help them. No, they're just living with what they're living with. We all have our own issues and these just happen to be theirs. So try not to frame them as suffering or victims. Another word to avoid is wheelchair bound. Just say, they're in a wheelchair. That works out a lot better. We really have to be careful not to impose our perspective about what suffering is or isn't to someone else. We all have limitations, and we all need to think of them and remember that we have those limitations and speak about other people without negative connotations because we don't want to foster a victim mentality for people. So part of that is to use people first language. So instead of saying someone is a disabled person, we say it's a person with disabilities. Instead of saying it's a special needs child, he or she is a child with special needs. So now it's your turn. Instead of calling someone a wheelchair-bound person, what could you say instead? Remember, people first. So you might have said a person in a wheelchair or a person with a wheelchair. That's people first language. Instead of autistic boy, we could say, try it. Okay, he's a boy who lives with autism. I have one friend who says, my daughter experiences autism, which is another way to look at it. Always put the person first. Remember, we're all children of God. We're all people with feelings and emotions, and we should all treat one another with respect and dignity. You know, I'm kind of a clumsy person, and I really don't want people to come up to me and say, oh, you know her, she's that clumsy person. You can just say, she's a person who has to be careful about her balance all the time, which I do. So just think of it that way. How do you want to be treated? What do you want to be called? Another thing to think about as we get ready to go into this weekend where you're going to be with buddies and people you don't know, how to communicate. So here are a few communication tips to think about. Ask your camper or your buddy how he or she wants to be addressed. Ask if there's a nickname they go by, if there's anything that they prefer. Maybe a boy's name is David, but he wants to be called Dave, or a girl's name is Sally Jane, but she only wants to be called by Sally. Once you know what your camper likes to be called, use that name throughout the weekend. Make some small talk with your camper if that's possible. Ask about their interests, maybe their hobbies, where they go to school, what grade they're in, information what their teacher's name is. If they go to work, ask about their work, ask about their family. Once you kind of have those basics down, it'll give you things to talk about throughout the weekend. If you see that your buddy or some other camper needs some assistance, go ahead and offer assistance. Don't just automatically give it, unless it's an emergency situation, of course, then you just go in and help. Offer assistance. You know, would you like me to help you get through that doorway in your wheelchair? And if your offer is accepted, go ahead and ask how to best assist. You know, what's the best way for me to do that? Should I turn you around to the back and tip your wheelchair up? Do you like to go in through the front? Just ask questions so you're sure to be assisting in the way that's most comfortable for the person you're trying to help. Whoever you are working with, offer a handshake. Even if the person has limited limb mobility or is missing a limb, they'll have a way to shake hands or to complete that greeting. If speaking through an interpreter, so if you're working with someone who maybe has a deaf interpreter, be sure that you speak to the person and not to the interpreter. You want to make eye contact with the person, listen to the interpreter, and then answer the person, not the interpreter. If the child has some communication devices, maybe they've got an iPad to help communicate or something else, or hearing aids or anything like that, ask the parents to show you how to use them, or if you need to help with them, or they might tell you, well, Billy can show you everything you need to know about this. So ask the parent first and then go from there. If you are working with someone or near someone who does have a wheelchair or a walker or some other kind of mobility device, always ask permission before you move that mobility equipment, because if you don't, you're going to leave that child or that person without any way to get around. So ask permission before you move it. Show the person where you've moved it to. Also, don't lean on walkers or wheelchairs when someone's in them. That really affects their balance and their ability to get around. In a similar manner, if we have any service animals here this year, and in some years we do, always ask permission before interacting with the service animal. Remember, that animal is working. If the animal is being petted by you, it may not be able to do the work it needs to do to keep a camper safe. If you're speaking to someone who has a visual disability, start the conversation by identifying yourself and any people who may be with you. So you might say, okay, Mary, my name is Jolene, and I'm standing here in front of you. To my right is Bill. Bill, would you say hi? Okay, and to my left is Sarah. Sarah, can you say hi? That way the person with a visual impairment hears our voices, kind of is able to fix the people in space and communicate more easily. Be patient if your camper has trouble understanding you. or if you have trouble understanding your camper. Always avoid frustration and avoid raising your voice. Instead, just repeat the information, and if you've tried to repeat it and you're not making any progress, or they've asked you to repeat something, then you might need to ask a parent or whoever is assisting them to give you a hand in the communication. Let's talk a little bit now also about safety and hygiene. Some of our campers have feeding issues. Some need to be fed. Some are fed through a feeding tube. Some can feed themselves. Take cues about your role in feeding campers from their parents. You will try at mealtime to eat with your camper and probably their whole family, and you want to be an assistant. So if the parents say, would you go and get this, or would you like to feed, or can you hold this while I put something in the feeding tube? Take your cues from the parents and work accordingly. If children need anything like assistance dressing, applying bug spray or sunscreen, that should be done by the parents, not by the volunteers. They will take care of all of that. Encourage sanitation for yourself and for your camper. So encourage hand washing if there's hand sanitizer around, especially if you're working with a child who's medically fragile. Make sure you use those supplies and keep your hands as clean as possible. If your child is a runner, and you will have that information before you meet your child. Every year we've had at least one child who's run a little bit, but we have security staff and we have walkie-talkies if we're green shirts and with the security staff, and we know as soon as possible that there's a runner. We get a description and we have our security people out finding the runner. If you have a runner, try to stay where there's some backup people available. Don't go for a walk down a wooded path alone with a child who may be a runner. Stay where there's going to be backup. If a child runs, ask for help from the volunteers around you, or if there's parents, just ask them, see if they can find a staff member in a green shirt, and then get out your cell phone and call security. You'll have those numbers on the back of your name tag. We'll give you instructions on what to do from there. If you're working with a child who has a standing frame or a wheelchair or some other kind of mobility device, check with parents about if you should move the child from the wheelchair or the mobility device to something else, and how to do it, so you know how to do that properly. Also, remember that you are never to take a child into a bathroom alone or diaper a child if they're diapered. That will be done by parents or camp staff, with the exception of children in the nursery. The nursery area is a big open area, so if you have to diaper one of the children in the nursery, there will be other people around to be watching. We just want to ensure your credibility as a camper, so that you can't be accused of anything happening, and we want to keep our children safe, of course. So we just don't engage in those activities. We leave that for medical staff and for parents. If there is some kind of an accident, somebody falls down, contact the camp doctor or the camp nurse immediately, and then get a staff member. And that staff member will fill out an incident report. One other area of safety that we want you to be aware of is that there are some children here who have seizure disorders. Now, we have never had a child seizure greatly at camp, but we want to make sure you know what to do in case a child does have a seizure. And we have a very short video done by kids about how to handle seizures in kids.
If you see someone having a seizure, don't freak out. Journey! Journey!
Try to stay calm. Make sure the person is safe by clearing the area around them and rolling them on their side. Don't put anything in their mouth. It is not safe.
Some people think you can swallow your tongue when you have a seizure.
This is not true. It's impossible to do. If there is someone nearby, ask him or her to get help while you stay with the person.
Toggy, Toggy, come quick!
If you can, time the seizure with a clock so you can tell someone how long it has lasted. Turn the person on their side if possible and place a soft but firm item under their head, like a jacket. Thicker items like a pillow don't work as well, since they can sometimes cover the person's nose and mouth. Try to loosen tight clothing, especially around his or her neck. Once you've done all these things, stay with the person until the seizure ends.
Are you okay?
Speak calmly to the person when they wake up, since they may be confused or scared and usually don't remember much of what happened. If the person has seizure medicine, get an adult to give any medication.
Marissa, call 911.
If the seizure does not stop within a couple minutes of that medication dose, it is best to call 911, even if the adult gave medicine.
The number one thing to remember is stay calm and don't freak out.
All right, sometimes awkward situations do occur at camp. So we're going to talk a little bit how to prevent them, and when we can't prevent them, how to handle them. First of all, if you sense a situation is going to become uncomfortable or a child is going to be out of control, as soon as you sense that, get a staff member to back you up. We have volunteers that will always be wearing blue shirts. Camp staff and security wears green shirts like mine. Campers wear red shirts. So look for green shirts, first of all, if you've got an awkward situation in the making. And if you can't find a green shirt, you can look on the back of your name tag and call one of the numbers there, or you can also grab somebody in a blue shirt that's another volunteer like you. Do get a staff member for backup as soon as you can, and then let the staff member decide if the parents need to be contacted. We don't want to be pulling the parents out of their activities unless we really need to. And many of our staff members are trained to handle these awkward situations and can take care of them. Watch for signs of overstimulation in your camper. Those could be things like rocking or yelling, screaming, starting to cry or looking fretful, fidgeting, maybe a fearful expression, or the beginnings of some aggressive behavior. And if you see any of those things happening, again, get a staff member to help you. And another thing to do if you can't get a staff member right away is to redirect the child you're working with to a quieter location. A lot of our kids get overstimulated very easily. So if you're in the middle of games in the Family Life Center and your child is getting a little overstimulated, pull them out into the hallway, into one of the chairs where it's a little quieter, and just have them sit for a few minutes until they're ready to go back. We're going to have a quiet room, which will have some weighted blankets and some beanbag chairs, soft music, soft lighting, and coloring sheets and other things for kids to do. So if a child gets overstimulated, you could also take them to the quiet room, and there will be somebody there to assist with you. Always be sure that you and your camper are in an area where at least one other person can see you. We don't want you going into a room alone with a camper at all. In past years, we've had situations where we've had children that need to sleep in the morning, but we've wanted the parents to go and engage in activities, so we've had 2 volunteers with those kids in their room until they wake up, and then the parents left instructions about what to do next. Also, be a friend to your camper, but don't encourage being viewed as a boyfriend or a girlfriend. That can quickly get out of hand, so just maintain that you are a friend to the camper. There's no girlfriend, boyfriend stuff going on. Finally, always keep your composure and speak kindly and calmly at all times. That can be hard. I know. I taught school for 25 years. But speaking calmly and kindly is the best way to de-escalate a child who is getting agitated. I want to go over a little bit of social media protocol. We will have camp photographers and camp videographers, so you don't need to be taking pictures of you and your camper. In fact, we don't want our volunteers taking pictures with their camper. Now, if the parents ask for you to be in a picture that they're taking of you with your camper, that's just fine. Go ahead and follow the parents' lead. And then don't send any pictures to Facebook or other social media. Parents can do that, but don't ask them to send it to you so you can post it too. That's for the parents to do. And also, we ask that you do no texting or phone calls while on duty, except in a case of an emergency. So we do want you to have your cell phones with you in case you need them, but don't be using them for anything other than emergency calls. So the last 2 weeks of May, we're going to be putting some information on the volunteer page about having a few Facebook Live discussions. There will be some with Kim, where you can ask him questions about the information in the training he did, and there will be a couple with me, so you can ask me for questions about what we've gone through. So right now, jot down your questions if you have any, and then stop back at the page now and then to find out when we're going to be having those live Facebook discussions, and join us, and you can submit your questions then. So again, thank you so much for being part of Wonderfully Made Family Camp. We're looking forward to meeting you and having a great weekend. And I'd like to end with a video that I think will show you what we're trying to do here at camp. It's a video about how a whole community came together to meet a person with disabilities right where he was and the impact it made on his life. Oh, and you might want to get a tissue first because you're probably going to need it. Thanks again.
Evet, kameralar kaydı girsin arkadaşlar.
Manav hazır ol. Şimdi. Taksi hazır ol. Hareket.